Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, speaking to you from the lovely JWC studio, as always. And today I am joined by one of our leading gynecologists, Dr. Unni. Thank you so much for being here, Dr. Unni.
Thank you, Kavas. It's a pleasure to be here.
Absolutely. Now, we have talked with another gynecologist in one of our earlier episodes, and we predominantly focused on pregnancy. I thought today, with your expertise and your vast experience, we could talk a little bit about the before and then the after, or the potentially way after.
Yeah.
So we're talking about everything from your first period all the way to menopause.
Right.
So I suppose starting with the before, I suppose the first question that everybody wants to know is sort of tips on how to ease period pain, because that seems to be the most popular thing that people seem to be asking.
Well, period pain is actually quite normal.
Right.
But it doesn't mean that young girls or women have to suffer just because it is normal. There is very safe medication available, which young girls as well as women can take. We prescribe it age appropriate and weight appropriate. So they should see a gynecologist if they're having a lot of pain.
Right.
And we can prescribe medication for them, which is very safe for them to take every period.
Okay.
Some of them will need just 1 or 2 tablets a day. Some may need 3 tablets right through the 3
And that's
or 4
like a
days.
painkiller type.
It's just a painkiller.
Okay.
But there's a specific painkiller which works on the enzyme called prostaglandin, which is what causes the period pain.
I see.
So it's not just any
Okay.
painkiller. We give an anti-prostaglandin so that it specifically targets the period.
Right. Well, maybe actually I jumped the question maybe a little bit earlier. Perhaps we should take one step back and just ask, what is menstrual health?
Okay. So girls nowadays are actually attaining menarche, which is basically puberty when they first start their period,
Okay.
much earlier than, say, a decade or two ago.
Yeah, in fact, I was just talking to another doctor about that in one of our other episodes about exactly the same thing. And why is that happening though?
Uh, Perhaps it's lifestyle because, their uh, nutrition is better.
Okay.
And also, obesity is playing a part because sometimes it's not just good nutrition, but
right.
it's overnutrition.
Yeah, exactly.
But they tend to start their periods even at the age of 10. So it's important that moms talk to girls about this so that they're not, suddenly they're in school one day and
Yeah,
they get
yeah.
a period and, they're completely upset about
Right,
it.
right,
And
right.
because there's all this blood and they don't know
yeah.
how to deal with it.
So, what are the things that you would tell, for example, you being the mother, what would you tell your daughter
Yeah.
for these kind of things?
So I think at about 8 or 9, we should start talking to them about
Right.
the fact that periods do happen, and it's very normal for a young girl to start having her periods at the age of 10 or 11, and it's part of growing up. And talk to them about sanitary napkins
Yeah.
so that they know that they have means to keep themselves clean and at the same time not allow the world to know that they're having their
Yeah, it's an
period.
unfortunate thing that it's such a taboo.
Yeah. So I think now that taboo is slowly going. I think, there's a lot of awareness.
Right.
Of course, a lot of Hindi films also being
Which is
made
good,
on those things,
absolutely.
which is very good.
Right.
And even in schools, they are having, they have machines where girls can get their sanitary napkins from, or there are vendors who are close available, so that, these young girls have all this access to all this. And the other thing which a lot of people are talking about now is the menstrual cup, because
What is that exactly?
it's like a silicone cup
Okay.
which women can insert into the vagina
Right.
after they're a little older, not the young girls who have just attained menarche. And it's environmentally friendly because they don't have to, dispose of sanitary napkins and things. So they can just wash the cup and keep it clean for the next period, or every day, like as often as they want to.
Interesting. Okay.
So, they don't need to worry about changing their sanitary napkin or even a tampon.
Okay.
They could just go into any public toilet,
Okay.
empty the cup,
Okay, that's
and
very nice.
reinsert it.
Right.
So that is something which slightly older girls or young women who are already sexually active can use
So that's
easily.
good that these kind of devices that that help that process for young girls. What are the things that people can do, these girls, to maintain a healthy menstrual health?
Yeah. So they should change their sanitary napkins every 3 to 4 hours.
Okay.
Should not remain in a wet napkin, particularly for those who are using tampons. They sometimes forget them, and then that can cause infections.
Okay.
So they must ensure that they change the tampon, even if it's not feeling very full, so that they maintain that hygiene. And once they get home, girls who are going to school,
Right.
it might be difficult for them to wash in the school toilets. But as soon as they get home, they should shower or bathe or clean that area well with
Cleanliness
water.
is a very, very
Yeah.
important thing.
So it's important
Okay.
that they do that. And, they don't think that it is something, a time of the month where they should restrict activities.
I was just going to ask that question. What
Yeah.
about things like exercise and doing that? Is
Yep.
that a myth? People should be stopping that when they have their
Yes,
periods.
it definitely is a myth.
Yeah.
They should continue with their regular exercise routine, whatever they do normally.
Right.
They don't have to do anything in excess. But that's why I'm saying even the pain, if they do have pain, they should go ahead and take a painkiller, but carry on with their normal activities.
Right.
And it's important for young mothers to ensure that their daughters don't see them sort of lying in bed during their period, because they learn from what they watch. So if young moms are also just active and going about their routine, then the daughters will learn that it's quite a normal thing,
Right,
and they can continue
Right,
their
right.
normal activities.
Okay. Another very common thing, slightly going off this particular topic, is PCOS, which is polycystic
Ovarian syndrome.
syndrome. Okay, is another big mouthful. What is that exactly? And that seems to be very common or becoming very common amongst girls. So I just thought we'd get what your views are on that.
It
how we
is
can deal with
fairly
that.
common. It happens in almost 20% of women.
Okay, what is it basically?
Basically, polycystic ovaries is that the ovary has these little cysts in it, multiple little cysts.
Okay.
And because of that, the hormonal milieu is different from what it is in other girls.
Okay.
Now, there's a wide spectrum of disease. It can start from just being happen to have been diagnosed on ultrasound with no manifestation of the disease at all or the syndrome at all. Or it could be that they're having menstrual irregularities as well as hormonal changes in times of, there's more of male hormone in these women.
Oh, I
So they
see, okay.
get facial hair, acne,
Okay.
that sort of thing. So they can also, and if they put on too much weight, then it aggravates the condition. So what they can do is try to stay as close to their ideal weight for height as possible.
Okay.
So maintaining lifestyle changes so that they remain ideal weight for height is important.
And these are all curable per se.
Yeah. Well, there's no cure as such.
that's the
They're
wrong
sort
word,
of
but-
born with it and they have to live with it.
Okay.
And if required, we have to manipulate their hormones based on what they need at that particular stage of their lives.
Okay.
For example, if it's a very young girl and if she's just wants her periods to be regular, then we give her something for that. If a teenager or a young adult has a lot of acne or facial hair,
Right.
wants treatment, we give
Okay.
different type of medication. If they need contraception, something
Right,
else,
right.
etc.
But the point is, anyone with PCOS can live a regular, normal life without any
Perfectly.
effect.
They
on
don't
that.
have to, yeah. So
Okay.
it may affect reproductive function. So
Right.
they may take a little while to get pregnant. But if that happens, then they can seek help and medication is available.
That's where experts like you come
Yeah.
in and help
Yeah.
everyone out. Okay. So, going to the other end of the spectrum, so to speak, menopause, what is that?
Okay, menopause is considered to have happened when a woman hasn't had a period for 12 months.
Okay.
And that
Oh, so
typically,
it's not a particular age-later thing. It's a...
yeah, it is to do with the menstrual period stopping.
Okay.
And around the menopausal transition, women may get periods a little late,
Okay.
every 3 to 6 months.
Right.
But until it's 12 months without a period, we don't consider that a woman has attained menopause.
Okay.
And this happens typically somewhere between the ages of 45 and 50.
Right.
In the West, it's taken as about 51.
Okay.
In India, most studies have said it's between 46 and 47. But in the urban areas, we are seeing that many women actually attain menopause between 50 and 55.
Okay.
So again, this could be lifestyle related. The thing is that they should attain menopause in the best health possible. So from the age of about 35, what women tend to do is,
Yeah.
once they've had their babies, they don't see a gynecologist again.
Okay.
Or may not see another doctor again
Right,
till
right,
there's
right.
a problem.
I see.
But the idea is that they should have their regular health checks.
Absolutely.
Because things like blood pressure, diabetes, all these things may not have symptoms in the early stages.
Right.
And if they're picked up early, then we can treat them before they get worse.
Yeah.
And
And you're talking about treatment for hypertension and diabetes and things like that, right?
all those things, as well as, cancer screening,
course.
whether it's for pap smears
Right,
for
right.
cervical cancer,
Of course.
mammographies for breast cancer. So all those things can be done
Right.
if they go for regular health
But
checks.
how does that link to menopause,
Menopause. What happens is, because estrogen goes down after the menopause, so a lot of things which they are protected from as long as they had estrogen in their body, for example, their bone health, their heart health, all these things get worse after the menopause. So if they know that, we know that there are certain risk factors, we can treat them, or just lifestyle changes may make them enter menopause strong
Okay.
and remain healthy, because women are living now to 80, 85, even
Absolutely,
90.
yeah.
So they need to maintain their health through that. They have to be
Right.
active and capable of...
Which comes to my next question is that what does change for ladies' health after menopause? What is it that makes
So
it different?
what happens is that because the estrogen is not there, their weight changes. It's not the weight so much, but the body composition.
Okay.
So there's more fat.
Right.
And it's more distributed around the abdomen.
Okay. That visceral fat.
Yeah, the visceral fat. And so because of that, they are at higher risk of heart disease.
I see. Okay.
And their bones require the hormones. So the bone strength, they get osteoporosis.
Okay.
So if they maintain their exercise, or if they know
Understood.
that they've got osteopenia, which is the stage before osteoporosis,
Right.
they can be put on medication. They can have just calcium and vitamin D supplements
Okay.
to ensure that they remain healthy.
Okay. So because of these hormonal changes, they're perhaps more susceptible to these lifestyle
Yeah.
type diseases.
Yes.
Okay.
And also, they are more susceptible to certain cancers after a certain age. That is not menopause related
Okay.
so much as age related.
right.
And it all sort of comes
Plays
at about
into
the
it,
same
yeah,
time.
absolutely. Okay, I see. So one has to be very mindful that
Yeah.
both things can happen at the same
At
time,
the
and
same
then
time.
it can cause a whole lot of
That's right.
disruptions.
Yeah.
Okay. So what are the typical you've got a vast experience in this field for many, many years. What are the most common myths that people come to you with, either at, for periods, or for PCOS, or for menopause, or any of these sort of matters that
Okay.
you would like to...
As far as around menopause is concerned, women always feel that, if their periods become heavier or closer together, it's all due to menopause and they need not see a doctor.
Right.
Which may not always be true, because these sometimes are sinister signs and may indicate a precancerous change.
Okay.
So they shouldn't put things down to menopause, but should consult their doctor.
Okay.
It may be that it's just a hormonal imbalance.
Right.
But it's best to get that checked out.
Okay.
And as far as PCOS is concerned, the main myth is that, some operation can be done to cure them of this PCOS.
Right.
Which is not true.
Okay.
They have to live with PCOS, but that doesn't mean that they can't live an absolutely
Exactly. That's what we
healthy
said
life.
earlier. That
Yeah.
is absolutely nothing wrong with
Wrong.
or being able to address it
Yeah,
with
they
the
can address
medication
it
or
with,
with the
medication if
healthcare.
required.
Right, right. Okay.
So these are the main myths as such. I mean,
Okay.
there are things
I'm
which
sure there are
come
many,
to
many,
mind.
many,
There are many
many.
more,
Yeah.
I'm sure.
But these are the large
Which,
ones.
yeah.
Okay, well, Doc, it's been a fascinating discussion on, as I said, the spectrum for menstrual health. So I will give you the last word on how would you like to leave us with some takeaways for maintaining your menstrual health? The
Okay.
biggest takeaways that you would like to offer.
Yeah, I will say just continue with normal activities and maintain hygiene. That is the only thing that is
See, I'm
required.
actually sorry, I don't mean to interrupt. I know I said I'll give you the last word, but maybe we can go on for a little bit longer. Uh, every guest that I've spoken to, we've always talked about things like nutrition, exercise, mental well-being for all the wellness aspect. But one aspect that I've actually not talked about with anyone or that anyone has brought up is this aspect of hygiene. So I think that is something that's really, really important that people should be being mindful of.
Mindful
It's
of.
it's it's
Yes.
a something that I've not had. Well, I'm a guy, so maybe or some aspect of this hygiene is something I have to be mindful of as well. But it is a great takeaway for girls of all ages that hygiene plays such a huge role in your menstrual health.
Yeah, very big part. And I would just like to add one more thing here
Please
that,
add as many.
yeah, wet swimsuits are another thing. Wet bathing suits can cause fungal infections.
Right.
So definitely, I would say that, if you're out for a swim for a long time, then come back and just shower at least
Yeah.
instead of just remaining in that wet suit, because often girls go on these holidays and they come back with fungal infections.
Okay.
So this is one tip I would give
That's a
them
very helpful
to
one.
enjoy their holiday before they come back and have to see a gynecologist.
Right, right. Okay. Well, thank you so much again for being here, Doc. It was really a pleasure talking to you, Dr. Unni. So thank you very much for being here.
Great to be here. Thank you so much, Kawas.
Thank you all and see you all next week.